this slide is what I want to say here is that we, it's our role to help you and to enable things as much as possible. So the patient to me is always at the center, and all of these are the health professionals that are around it. But it's another person that is very next with the patient and the family, because it's very important for me to remember sometimes it's just not the patients and the family, is your GP. I cannot stress how important it is to have a GP that is involved and that is there and is going to be there for the long haul, so that can help you. And he's got to be the gatekeeper of what is happening with referrals to all other specialists. And you have a condition where you're going to see multiple specialists, and that is really important to for your GP to be the gatekeeper. But I also think that the family members that some of us, as we get sicker, family members step in and help. So it's important for that family member to also coordinate the care. And something that I find really important is, for instance, correspondence. There are so many different people, and you go and see another specialist and they may change the treatment that you are on. And if that's not communicated to the people that are required to know about that change in treatment, it can cause problems. Like just yesterday, I had a patient that I had discharge summaries, I had correspondence to say this particular patient was on insulin. But when I finally just managed to speak to the family member that was the gatekeeper that was unable to come to the appointment, it came to the front that since the patient had been discharged from the group home for more than 3 weeks, he had no insulin. So it's really changes in treatment is something that it's not only just in diabetes, but it's also, I'm sure, in the conditions, in the other conditions, it's really important to keep track of. And I can't, suggest to people that they take a picture, an image of their Webster pack. So when they go and see a specialist, you've got the latest image of the Webster pack. At the top, they usually have all the drugs. So take that with you, because that just saves a lot of issues, and it's an important part of the management that we have.